receive many questions from the videos that we post on YouTube about pudendal neuralgia. So today we're going to take some of those top posts and address them in this short video. So the first question that we're going to address is pudendal neuralgia something that can go away on its own? If so, how much time should you wait before seeing someone? The answer is it really depends. So if the nerve is irritated for a short period of time or for a particular reason, and that reason has been eliminated, the nerve may indeed heal on its own. But when the nerve is irritated for a long period of time, or if the things that are irritating the nerve continue or persist, then likely that nerve is not going to calm down or heal on its own, and it's likely going to need some sort of medical intervention, most likely at the very least pelvic floor physical therapy, and it may require some other types of medical intervention like pain management or some nerve-directed therapies. So this is really something that you should speak to a specialist or someone who specializes in treating pudendal neuralgia to figure out if you should pursue further medical treatment or allow it to heal on its own. The next question is there a direct cause of pudendal neuralgia? And the answer is yes, there definitely can be direct causes to pudendal neuralgia. Things such as vaginal childbirth, sometimes surgically induced injuries to the pudendal nerve can irritate or cause pudendal neuralgia, falls on their backside. Those are more direct causes of pudendal neuralgia, but there can also be indirect causes of pudendal neuralgia that can happen over a period of time. For example, constipation. If you suffer from constipation for weeks, months, or years, that irritates the pudendal nerve little by little that will often eventually lead to pudendal neuralgia. Also, there can be activities such as certain exercises as squats or other activities that can put a little bit of irritation on the pudendal nerve, and over time, pudendal neuralgia can result. So this is also something that is best to really talk to your physical therapist about, because depending on why pudendal neuralgia occurred is going to become important as one builds a treatment strategy to resolve those symptoms. Next question is it possible to have pudendal neuralgia without having urinary or bowel incontinence symptoms? And actually, in pudendal neuralgia, bowel or urinary incontinence is actually very, very uncommon. We see incontinence issues when we have a pudendal neuropathy, when there's an actual injury to the nerve. This is when we see motor dysfunction, which is what incontinence is. So with pudendal neuralgia, we can see urinary or bowel dysfunction, which would be things like pain with urinating, pain with defecating, or urinary frequency or urgency, or maybe difficulty evacuating your bowels. Now, to have pudendal neuralgia doesn't mean you necessarily have urinary or bowel dysfunction. You could have pain in other areas of the pelvis. And this is because the pudendal nerve has 3 branches. Each of these branches supplies different areas of the pelvis. And with pudendal neuralgia, you can have one or more of these branches irritated, but it doesn't have to be all 3. Therefore, if the dorsal branch, or the branch that just goes to the clitoris, is irritated, you may not have any urinary or bowel symptoms at all. You may just have clitoral or penile pain. Whereas if the perineal branch of the nerve is aggravated, that may include not just perineal pain or vaginal pain or genital pain, but it could also involve urinary symptoms or bowel symptoms. Now, the rectal branch, or the inferior rectal branch, it could also cause difficulty with bowel movements or pain with bowel movements, but is likely not going to cause urinary symptoms. Next question is, what exercises should I stay away from, such as lunges or squats? Again, really great question, and the answer is It really depends on which branch of the nerve is aggravated and what the other musculoskeletal myofascial impairments are. So this is something that absolutely needs to be discussed with your pelvic floor physical therapist, because depending on what those other impairments are, so whether the dysfunction lies in the surrounding muscles or joints or tissues, is going to really impact exercise prescription. But I will say, in general, the nerve is further aggravated when it is put on stretch. And the nerve is put on stretch when we flex our hips past 90 degrees, as with a deep squat, like a catcher's squat. Other exercises that may also flex our hips past 90 degrees, maybe walking up a really steep hill or doing the Stairmaster. So those exercises should be done with caution, but really you should talk to your physical therapist about your particular symptoms, which part of the nerve is aggravated, what your other impairments are, so your physical therapist can help you put together an exercise program that is best fit for you. So the next question is, well, what exercises can I do? And of course, we absolutely want to encourage our patients with pudendal neuralgia to continue to exercise in order to rehabilitate any sort of muscle or nerve or soft tissue. We do need to exercise. That increase in blood flow that we get with exercise is necessary for rehabilitation. So there's lots of exercise you can do if you have pudendal neuralgia. Most people can tolerate walking, even brisk walking. Swimming is often tolerated with a light scissor kick. Strength training will be fine for the upper body, and maybe light strength training for the lower body. A yoga program, particularly when you're working one-on-one with a yoga instructor, can be a great form of exercise. And same with Pilates, a one-on-one Pilates session with someone who can modify the exercises that are right for you. So I think it's important to remember that exercise does not have to be very intense. It can be light to still be effective. So there are a lot of things that you can do. And again, this is something that is so important to speak to your pelvic floor physical therapist so they can help you develop an exercise routine that is good for you and your particular symptoms. So next question, are feelings of fieriness, sharp poker, and throbbing congruent with pudendal nerve symptoms? So in general, neuralgia is pain of a sharp, shooting, burning, lancinating, lightning bolt type symptoms. And with pudendal neuralgia specifically, it is those types of symptoms, so sharp, shooting, burning, in the territory of the pudendal nerve. So that means where the pudendal nerve goes to. And in general, that's the urethra, the genitals, the perineum, the anus, and the perianus. So if you have those types of symptoms, burning, shooting, stabbing, lancinating pain in those areas, then pudendal neuralgia is definitely a possible diagnosis and should be evaluated further. Next question is, how many different types of entrapments are there? So there are two primary locations that the nerve gets entrapped. The first is in Alcock's Canal, which is a tunnel that the nerve travels through that is made up of the sacrotuberous ligament and the obturator internus muscle. The other place of entrapment is between the sacrotuberous and sacrospinous ligaments, or actually through one of these ligaments. And this is by far the more common area of entrapment. So next question, can the nerves remain dysfunctional after decompression? And unfortunately, yes, the answer is yes. So nerve decompression only treats one part of the pain syndrome. It creates more space for the pudendal nerve to move, slide, and glide by decompressing it. However, it does not address any of the musculoskeletal impairments or the myofascial impairments or any movement patterns that may also be contributing to this pain syndrome. So really, to comprehensively treat pudendal neuralgia, especially in the case where the nerve is entrapped, you have to treat all of the symptoms, or that nerve may continue to be irritated even though it is decompressed. The surrounding structures or the movement patterns or the surrounding tissue may still be putting pressure or putting tension on the nerve, causing a continued irritation. So again, this is why it's so important to work closely with a pelvic floor physical therapist who is very familiar and comfortable treating especially this type of pudendal neuralgia, so they can help you through that rehabilitative process. So the last question is central sensitization a reason for failure of surgery? So central sensitization can be one of the reasons that a surgery is not completely successful. So it's important to work with a pain management specialist to address the issues of central sensitization. And we do this, pain management specialists do this before surgery and after surgery, often with pharmacotherapy or medications. There are other treatment strategies to help treat central sensitization that you can work with your pelvic floor physical therapist. But yes, it is something that is crucial to be addressed in the full rehabilitative process. So those are all the questions for today. I hope this answers some of the questions that you have as you watch our videos. And if you have any further questions, feel free to submit a question and we'll address it at another time. Thanks so much.